Orthopaedic Hospital have today given you a title. They said that from today onwards, that your name is now OG Director Mo.
In the heart of the coal city of Enugu, in Enugu State, lies one of the national treasures, the National Orthopaedic Hospital. A place where hope and healing come together. A trusted and respected institution for orthopedic care for both old and young. Every day, people from all over the country come here to seek treatment for their orthopedic needs. But this hospital is more than just about medicine, but about the people who work here. Meet the visionary at the helm of affairs of this institution, Professor of Medicine and a medical consultant, Emmanuel Iyidiobi.
I was born about 51 years ago at Ako in Igweti local government area of Enugu State. I had my primary education at Central School in Bodo, from where I proceeded to the prestigious St. Teresa's College in Soka for my secondary education. That was concluded in 1990, where by God's grace I had 9 distinctions and immediately got admission to read medicine in the University of Nigeria in Soka. I concluded that in 1998 and was in the Dean's list of best 10 students at Ogbea local government area for my national youth service. And while I was there, I did primaries in surgery. And when I came back to Enugu, I got enrolled into the residency program of this hospital. I finished training as an orthopedic surgeon in 2007. And next year, I was appointed a consultant orthopedic and trauma surgeon in this hospital. I noticed that my quest for education and teaching students was not really fully met. So I took a course in Masters of Physiology. Did it, finished it, and also did a PhD in Physiology. And while I was growing in ranks and file, I saw a need to also get a Masters in Business Administration, which I did in ESU Business School. If you're an orthopedic surgeon, that is not enough. You need to deepen your knowledge, deepen your skill. So I did that in spine, and that was in Frankfurt, Germany.
Professor Iyidiobi's career soared as he took the reins as the medical director with a favor that would define his tenure. It was an initial 6-week stint in an acting capacity. His ascent to this role was a testament to his dedication and expertise, which marked the beginning of an era.
I felt a lot of burden, a lot of load, a lot of responsibilities before me, knowing that the task of running a hospital well is not a child's play. Having done my residency here and been a consultant here for nearly 15 years, the challenges of the hospital are clear to me. The strength of the hospital is also clear to me. So the first thing I did was to mobilize that strength. The strength of the hospital is the manpower which we have. I noticed that there were a lot of backlog of promotions. A lot of staff were stagnated. And so what I did was to liaise with the Federal Ministry of Health and the head of service and got approval to promote all eligible staff, convert all eligible staff. In fact, after that event, the hospital was agog with celebration, and I knew that we had pressed the right button.
Today is a joyous day in National Orthopaedic Hospital. The last time workers gathered like this to dramatize, they gathered to dramatize the shameful condition the workers of Orthopaedic Hospital have found themselves in.
Assessing the hospital's needs formed the basis upon which Professor Emmanuel Idiobi laid the groundwork for change. This he achieved through a comprehensive three-point agenda.
The founding fathers of this hospital, they did a lot of job in the hospital, and my predecessor, Professor Kajetanwa, also did a lot in the hospital. So I inherited a functional hospital, but I also had a role to take it to the next level. So there were difficulties that I noticed. One of the greatest difficulties I noticed was that I noticed has been that this hospital was not purpose built. In fact, where we are is the bedroom of the then East Central State government. So that tells you that majority of the structures where we see patients, where we operate on patients, they are makeshift structures. It's not a purpose-built hospital. For instance, we had 7 theaters scattered all over the place, and you have to post medical staff, buy equipment for each of them to be able to run the hospital. So that was not bringing up the best in the hospital. I also met a group of staff that could be better motivated. So those things I saw formed the fulcrum of what I call the three-point agenda with which I am running the hospital. The first one is patient welfare, because everybody working here, be the person admin staff, be the person a doctor, a nurse, we are all here converged for the patient. Now, the next pillar of my target is staff welfare. And unmotivated staff can hardly achieve anything. So I took it upon myself to do those two. Now, the third aspect of that is that while I'm doing that, I also have to improve the infrastructure and the environment. So these things also align with the national health policy.
These are some of the equipment we have. These are mobile X-ray. Our patients are attended to right here in the ward. You don't need to move them for X-ray. So this is our trolley. Sorry, patient. And this is our bed. For Arctic 4. This is a new purchased anesthetic machine. Automatic, everything here is functional.
His vision brought a renewed energy to the hospital. The changes were visible, from updated facilities to improved patient services.
The trauma unit of the hospital was built about 20 years ago. And when I took over, it was really dilapidated. So we, with my management team, we rehabilitated the trauma unit and re-equipped it. As we speak, the emergency theater of this hospital has standard operating table, standard operating lights, brand new anesthetic machine, And for the first time, it also has a C-arm. C-arm is an X-ray equipment that you can use to see the bone or the joint while you're operating. So instead of just doing what you can and coming back later, you can definitely finish the treatment of the patient in that emergency unit and discharge the patient. Now, we didn't stop at that. This hospital also currently has a 34-slice CT scan. This is one of the assessment tools in orthopedic practice. In fact, it is difficult to practice modern orthopedics without having CT scan. Intensive care unit. It was built during COVID, and we had about 3 functional ventilators, but it's a 10-bedded ICU. So as we speak, we have procured additional 5 ventilators.
And this is one of our ventilators. We have 5 of them. So we use them to take over respiration on patients.
When we produce sterile materials for surgeries was inadequate. So we have built a new CSSD department, that is Central Sterilization Unit, where the sterile materials for dressing for surgeries are produced. Beyond the building is also the equipment, the autoclaves for that process.
This is autoclave machine. It's used for sterilizing packs. As you can see, packs here. This is sterilized pack. These ones are waiting to be sterilized.
Professor Emmanuel Idiobi's leadership and visionary skills has indeed transformed the hospital.
I also noticed that the theaters are scattered. So I got approval to commence the construction of a 10-suite theater complex. When we complete that, what we intend to achieve with that is that all the surgeries will be done in one place, apart from emergency and infected cases that will mandatorily have a different suite. That way, we will be able to manage the manpower, the equipment as scarce as they were. So these are some of the things we have done to ensure that our patients do well. Now, there are 2 other projects I want to speak to. One is the new administrative block. It is about 70% completed. And then the old OPD is also undergoing renovation. I believe that before the year runs out, we would take delivery of that building.
The National Orthopaedic Hospital is a vital part of the health sector. As such, the MD projects to work on staff welfare, trainings, massive renovations, and exploring a variety of ideas to make it a medical tourism site.
We have rehabilitated the main Unit 1 complex, that is Ward 1, male Ward 1, female Ward 1, the private ward. I've also rehabilitated the amenity ward. As we speak, male Ward 3, isolation ward, the equipment, instrument department are also undergoing renovation. Anything you are going to do for a patient in this hospital is largely power-based. If you have to suck a patient that is in the ward, you need electricity. If you have to operate, you need electricity. If you have to do X-ray, you need electricity. And we were paying 20 to 25 million naira to buy diesel in a month. I made it a priority to start thinking out of the box to use alternative power supply. So as we speak, all the wards, all the 13 wards in the hospital have solar power, so that when there is no light, the patients can at least have light, have fan, and we should have sockets to give them basic treatment.
We have light steady, and we have overhead tank where we have water steady running in IC.
We have installed CCTV in most sensitive areas of the hospital. This is to enhance security and ensure that life and property are also protected. We have also concentrated some efforts in training and retraining staff. Like all the staff, all the academic staff in the College of Nursing have been retrained preparatory for the college.
No doubt, the improvements have been remarkable, but securing adequate funding remains a hurdle he is still striving to overcome in transforming the face of the National Orthopaedic Hospital, Enugu. More support is critical.
Government has a lot of constraints of fully funding the hospital. The allocations from government has come, and one thing also is to get that fund and utilize it prudently and properly, which is part of why we're able to do this much in such a short time. But when I took over, I noticed that there were gaps in internally generated revenue. So we did an audit and saw that in some circumstances we were under recovering costs. And that accounted to some of the huge debts that we were owing suppliers. So we closed those gaps in supplies and ensure that the funds that are coming to the hospital stay in the hospital. For instance, when I came in, cash collection was 80%, electronic collection was 20%. But that has reversed now. We now collect 80% electronically and 20% cash. And even at that, we are working hard to ensure that there is this completely cashless environment. But the challenge of starting a new institution is enormous. So we need special intervention fund, a takeoff grant to be able to build the classroom block, the administrative block, as well as more hostels, because we expect that in the years to come, the students will grow and they will need a place to stay.
The hospital is renowned for its dedication to research and innovation, as well as its commitment to the training of the next generation of orthopedic nurses. Hence, the establishment of College of Nursing Sciences.
If you employ 100 nurses today, in the next 6 months, about 40 of them will leave. Where are they going? They are going overseas. The processes of getting manpower, and so that you can also join in the production, that is supply chain. And that was how he conceived to commence the establishment of National Orthopaedic Hospital College of Nursing Sciences. And as I speak with you, we had over 3,500 candidates, making efforts to join the new school that has been approved. And then more importantly is that we are hoping to produce young men and women who will join the workforce in the nursing profession. And indeed, nursing has become the most sought after profession the world over. With my predecessor then, we had been working on establishing the Institute of Orthopedic and Plastic Surgery. And eventually when I took over, we concluded that. And then this hospital, the institute is affiliated to Abia State University. And they have appointed professors in the hospital, of which I am one. And then that institute is also running PhD in orthopedics and trauma as well as in bones and plastic surgery. So we are using one stone to kill several birds.
The National Orthopaedic Hospital, Enugu, is quite unique, with a community of specialists saddled with the responsibility to correct facial and body abnormalities caused by birth defects, injury, or diseases. That is exactly what happens here in the Plastic and Reconstruction Surgery Department.
The National Orthopaedic Hospital, Enugu, is one of the leading hospitals in Nigeria, providing specialized care for patients with injuries or diseases of the bones, joints, and muscles.
To heal a patient, you do not just need medication. You need an environment that is appealing, an environment that allows recuperation. And that is why we have also paid attention to the environment. If you walk around, you see the green areas, lush and well-trimmed flowers, the curbs, well kept.
Meanwhile, as one of the leading specialist hospitals in Nigeria, the challenges faced are enormous.
The manpower challenge is one of the greatest. People are leaving the hospital through the Japa syndrome, going to Europe and America and Canada. And the greatest challenge is that as they leave, the platform to replace them, is the bureaucracy is long. So we have been making presentation to government to reduce the bureaucracy while ensuring that there is no abuse, so that we can easily replace the staff as they leave. Now, the other challenge is the challenge of power. Now, we have done what we can as an institution to improve it, but even at that, the load is still more. So we are also calling on government to either take over the power cost of the hospital or provide a solar farm in this hospital, so that even if it is possible that we can leave the national grid, or even if we don't, at least reduce the cost of diesel to the barest minimum. The other challenge which we are very passionate about is that challenge of MRI. We are talking to an investor quite all right, but we would rather prefer that government procures this MRI for us, so that we can own it and run it the way that we would ordinarily want.
Professor Emmanuel Iyidiobi's journey and the transformative impact he has made inspires a positive hope for the future of the National Orthopaedic Hospital, Enugu. 5
years from now, we want to ensure that our staff become even more motivated. People should be able to be promoted as they are qualifying, get their salaries and emoluments as and when due, and if they need to be trained, they need to be trained. So that also leads us to the work environment. We want to ensure that the work environment remain and continue to get better, so that people can put in their best and give in their best. Now, we are hoping that time we will have built up the College of Nursing Sciences, which we started, the administrative block, the classroom block, and by then we will have had our first graduates. We also have a vision to establish a College of Orthopedic Technology. That college, when established, will award HND in orthopedic casts and then prosthetic and orthoptic devices, so that we will have professionals that will assist in POP application and have professionals that will be able to manufacture artificial limbs for those who have who are unfortunate enough to be amputated. Now, 5 years going, I believe that the 10-suit theater will have been completed, and we will not need to be running from one theater to another, carrying instruments from one theater to another. We will have a centralized theater. 5 years going, I believe that we have established an oxygen plant, which we are not fortunate enough to be among the selected hospitals that government have provided oxygen plant.
Today, the National Orthopaedic Hospital, Enugu, is wearing a new look.
Professor Emmanuel Idiobi's relentless pursuit of excellence has set the stage for a future that surpasses boundaries. His vision, dedication, and unwavering resolve continue to shape the landscape of orthopedic healthcare, not only in Enugu, but in Nigeria as a whole.
God has wiped the tears of so many. Using the hand of one man. To God be the glory, and to the people of God the blessing. So